In this video, I want to go over the heart and the cardiac cycle. So here is a picture of the heart. It's not labelled. So we're going to start by working out which is the left and which is the right. There are obviously a couple of ways we can do it. The most obvious way is to imagine it's inside you. So therefore, this is the right-hand side and this is the left. But the other thing you will notice is that the cardiac muscle, which makes up the left-hand wall here, that is much thicker than the cardiac muscle that makes up the right wall. And that's because the left-hand side of the heart is going to put the blood under high pressure to send it all the way around the body, whereas the right-hand side of the heart is going to put the blood under low pressure because it's just sending it to the delicate lungs and the capillaries that are there. So if we start with the right-hand side, we've got blood coming in these vessels here. They're both called the vena cava. One is the superior and one is the inferior, but don't worry about that too much. And then blood goes into this section over here. This section over here is the right atrium. And then the blood will go down through these valves here, which are called the atrioventricular valves because they are located between the atria and the ventricles, and they need to be open to allow the blood through from the atria to the ventricles. The blood will then make its way into the right ventricle. From the right ventricle, the blood will leave the heart and go to the lungs in the pulmonary artery. As it's going through the pulmonary artery, you'll notice here there's another set of valves. Okay, over here, they are called the semilunar valves. They're actually a set in both arteries, so we'll label them together. They're called semilunar because they look like heart moons, like that, hence the term. Blood will then come back to the left-hand side of the heart in this vessel over here, which is the pulmonary vein. Vein because it's carrying blood to the heart. Go into here, which is the left ventricle, left atrium. Okay, I'll label it down here, the left atrium. Then go down through an atrioventricular valve, so we can label that one there, same as before, into the left ventricle. And then up out of the heart through the semilunar valves in the aorta in the main blood vessel going to the body. So we need to think about what happens in order for blood to go in and out through the heart, bearing in mind that it will be coming in to the left atrium and the right atrium at the same time, then down into both ventricles, then up out of the arteries. So if you think in, down, up, that's the part of the way through the cycle. In, down through AV valves, up through the semilunar, and then we repeat. So if we look at the actual cycle, it's made up of 3 stages. Stage number 1 is called diastole. Diastole, which basically means relaxation. The heart is completely relaxed. Nothing is contracting. The AV valves here are open. So blood just literally pours in, goes through the atria, either on the right-hand side or the left-hand side, and just makes its way down into the ventricles. Then we have the atria contracting, otherwise known as atrial systole. That equals the atria contracting. When the atria contract, they push blood through the open AV valves into the left and right ventricle. So whereas before in diastole it was just a trickle, now we're forcibly emptying the atrium completely. And then once the atrium have been forcibly emptied, then the ventricles will contract in ventricular systole. And force the blood out through the aorta and the pulmonary artery. Now, obviously, when it's forcing the blood out, It needs to make sure that the semilunar valves are open because we've got to go through them. But the AV valves, these ones over here, they need to be closed because we want blood to go that way. We do not want the blood to go back into the atrium again. So we're going to close those valves at that point, open those valves so blood goes through the right direction. And those opening and closing the valves is really important, and it's all done by pressure changes. So if we have a look at a very common graph that you're probably used to seeing, okay, this is a graph of the left atrium and the left ventricle and the aorta. So we're only looking at the left side of the heart. Bear in mind that the right hand side of the heart would look very much the same, just the ventricular pressure would be much lower because the ventricle wall is much thinner, doesn't have as much cardiac muscle, and therefore it cannot contract as much. But the principle is going to be the same. So we've got here, you can see a little bump over here of the atria as the atria is increasing in pressure. That is atrial systole. Okay, so we've got atrial systole here. The atria contract, increase in pressure, and then decrease, forcing the blood through those AV valves. Now there comes a point where the pressure in the ventricles becomes greater than the pressure in the atrium. Now I want to show you what I mean. If I draw just a rough picture of the heart here, without going into too much detail. Okay, so I did say it was a rough picture. Okay, you have to imagine that the pressure in here has got really, 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 really high, much higher than the pressure in here. What's it going to do? It's going to force this valve, it's going to force it completely shut. Okay, because this valve is a one-way valve. It only opens in that direction. So if there's a lot of pressure forcing in the other direction, it will just shut completely. So that is what happens over here. So when we're describing why the AV valve shuts, we need to say that the pressure in the ventricles is greater than the pressure in the atrium. Obviously in the exam you wouldn't write the symbol, but it's just to show us what we mean. So then the ventricles are filling up with blood. Now as they fill up with blood, the pressure inside them will increase. And of course at some point they will also contract. And as the pressure increases, eventually the pressure in the ventricles becomes so high that it forces those semilunar valves, which were sitting in here, it forces them open so that the blood can leave through the artery. So the semilunar valve over here, it opens when the pressure in the ventricle is greater than the pressure in the aorta. So now what we're seeing is we're going to see that there's going to be less blood in here because it's all making its way outside. So what happens? Of course, the ventricular pressure will decrease because it's got less blood in it. But as it decreases, there's going to come a point at which the pressure in the aorta is higher than the pressure in the ventricles. Now again, these semilunar valves, if I show them to you in a slightly bigger detail, that's blood vessel. There's the semilunar valves. They only open in one direction. So when the pressure gets really high in here, in comparison to here, the valve is forced shut. So here, at this particular point, it closes because the pressure in the aorta is greater than the pressure in my heart for a minute, pressure in the ventricles. So then the pressure drops, keeps falling until finally the pressure in the ventricles is so small that the pressure in the atria is now higher than the pressure in the ventricles. And it forces the AV valve to open, remembering that the atrium will still be filling up with blood even as the ventricles are contracting. So they will be filling up with blood, the ventricle will be empty of blood, so therefore the pressure in the atrium will force the valve back open again. So whenever you're looking at valves, think about the pressure. Where is the pressure greater in comparison? That's what forces it open or close. Now, the other important thing to notice is our aorta. You'll notice our aorta only decreases in pressure slightly. Remember, the aorta is not, although it has some muscle in it, it's really about maintaining the pressure, and that's because of the elastic tissue which is in the aorta, which is squeezing on those arteries. Now, the last thing for us to think about in terms of the actual heart is to think about what we call the cardiac output. So cardiac output is the volume of blood pumped out of the heart in 1 minute. Stroke volume is the volume of blood pumped out of the heart in 1 beat, and heart rate is the number of beats per minute. So how do we connect them all? Well, it's a very simple equation. Cardiac output equals stroke volume times heart rate. When you go to exercise, initially your stroke volume and your heart rate will increase. Your stroke volume will increase because your heart will contract more. Your heart rate will increase because you will be contracting more beats per minute rather. So your cardiac output will go up. Eventually, however, if your heart rate gets too high, you'll find your stroke volume will drop, and that's because your ventricles don't have enough time to fill up with blood before they're beating again. People who are athletes, who train regularly, their heart increases in size, their ventricles increase in size, their ventricular muscle increases in size, which means they get more forceful contractions, which means their stroke volume goes up. So in order to keep their cardiac output the same, their heart rate can go down, which is why athletes can have a heart rate as low as 50 beats per minute, because in each beat they're pumping out more blood.